Hi, my name is Brittany Whitebear. I am a student at United Medical Institute and I am filming my capstone project, and I will be scanning part of the abdomen today. To start, we prepped the patient. We gave them paper towels to go ahead and put on some gloves. Okay, so we are going to be scanning the aorta today. We are going to make sure our machine is set to the correct probe. So we're going to click on probe, and then we're going to click abdomen and then the aorta option. For the scan of the aorta, we are going to use a curvilinear transducer. It's about 2.5 to 5 megahertz. Once the gel is applied to the transducer, we are going to make sure the notch is facing the correct direction on the patient. We're going to go ahead and start in a sagittal position, so the notch is going to be facing towards the head of the patient. And then as you can see, this is in the sagittal view. As you can see, we are in sagittal view of the aorta. This is the prox, and we are going to decrease the depth so we get a better view of it. Once we are in a good view, we can adjust our gain. Go ahead and freeze the image once we feel like it's in a good spot. And then we're going to go ahead and comment. And this is going to be Sag, aorta, prox. And we're going to set that, and then we're going to go ahead and save the image. And we're going to go ahead and measure. And it's from outer wall to outer wall. And then as you can see, that's our measurement there. And then we are going to title this Sag, Prox, Aorta. And then we're going to save the image. With color, so we're going to click on color flow. We're going to go ahead and adjust our box. You want to make sure the scale is set correctly. And then we're going to go ahead and freeze. And we're going to save that as well. So we're going to apply color. And then we're going to go ahead and click on pulse wave. We're going to align in the center of the aorta, and then we're going to ask the patient to hold their breath. And then we're going to go ahead and freeze the image. And we're going to save. Done with our scan, we're going to go ahead and grab some paper towels. We're going to wipe off the excess gel on the transducer, and then we're going to spray some transeptic and just make sure we clean the transducer really well before another sonographer uses it on another patient. More paper towels for the patient so they can clean themselves up, and then that will be it for the procedure. Thank you.